Meghalaya AIDS Control Society haka jingi trilang bat ka office district commissioner ka Bhoi district menta ka sing kan yutrik risau kala pelong ka integrated health camp haka snong yomolong Bhoi district. Ya kan ka integrated health camp la kersan ru da ka office jong district medical health officer Bhoi district Lyngba ki doktor ki nurse bat ki pharmacist bat kumjuru da ki dawai ki balapan biang da kan ka trat rikam. Haswa bat sedangi kan ka integrated health camp la yo ban pelong shwai ka jinyalang ka blingkon haka balawan baredan bentalang do ba mineral bonds amle ka nongpo ubla pliru ya ketika integrated health camp haka jindor kat Raja Brahma additional deputy commissioner ka Bhoi ka Dr. B Dirkus project director MSCS lambat kiwi ki doktor ki officer na ketenat ka kojakya bat kiri Paidbah.
Dia minta resmi nakaliang juga office jong Meghalaya AIDS Control Society ringkat bat ki baka office jong district medical and health officer jong Bhoi district apa ka jingalam jong i office jong deputy commissioner jong Bhoi district ida pilih yakni ka integrated health campaign ka bangin le akani ka district Bhoi hakani ka integrated health campaign min wan chi gishnong jong pi tikindan ko maalai tili gishnong ka jo ka jaka ti yakani ni sedang no menta kasni bat kani kan long do al banai ti yaki tarik bakan wan chi gishnong jong pi din sapin bana gishnong jong pi ngom ha ba pen yawan Paidbah skini ka camp tikini ka camp ki integrated health camp hangni yo ka jing sumar ya babun jat ki jing pang nalor bangin dia ki test long kin long ki ba yo a pim dan kamban siu kumjur ka jing sumar na benta ki jing pang ban lap hak pring ka ni ka camp e ki taru pin yo a tiki ni ki jing pang kin thop ya ka jing screening ya ka HIV AIDS screening ya ka ya ki jing pang ni ki disability amu dan ki jing duko ki jing bambyang ki department nang benta ka TB nang benta ka hepatitis A hepatitis B hepatitis C nang benta ki khmat I check up ngindan kendan ru nang benta ka jing check ki benyat ngi ong ka dental check up nang taru hangning in test ru ki bapang diabetes ki bapang kiyoshini mo yang diabetes ba kiyoshini nang ta kumjuru nang benta ki to ki ba QBP hypertension but kiwi kini ong ki non communicable disease dia ni priang subhang ikot subhai pipen wan chini kam nang taru nalon jo kini ngi ye trailang ru bat office jong BDO kumta kandan ru ka Aadhaar enrollment bat ru kumjo ka MHIS enrollment so ha ban wan chini ki kam nang pinyo e kini ki jing sumar e gindan adu tili hakisnong beper kita ngi ong ki static camp kamot ki banlong ki community hall dan ni no ka jaka bikin sa penbiang na kisnong but ngindan mo kita ka extended outreach ki bangin let ko maki ki jaka ki ba kanenum Paidbah ko maki bus station ne hakini ki industry no kita ki extended outreach kita bakin dosis pa andro ko atali
yang jong ka Meghalaya AIDS Control Society habis itu Lyngba ka district medical Bhoi district. The initiative taken by the central government, especially with regards to Bhoi district being an aspirational district, where we have witnessed different initiatives that has been taken in the last 4 to 5 years. Since 2018, but Bhoi district has been regarded as aspirational district by NITI Aayog, government of India. We have seen different indicators and parameters that has been identified, especially with regard to health and nutrition, education, social welfare, and other line department. At the same time, strengthening livelihood of people within the district. It is quite impressive where we have seen initiative taken and the kind of project and scheme that has been brought within the mentioned indicators in this line department. Even though sometimes as a legislator I felt that Bhoi district being an aspirational district, it has been treated at par with other districts. It is of no use that being an aspirational district. But when we go deep into it and study it properly, there are differences. And there are issues that has been concentrated by this concerned department, especially with regards to health, where different sub-center and PHC has been upgraded, where facilities, be it funded through NITI or funded through CSR from different corporate houses within our district.